So just a quick video of a patient that I was thinking about. There's a movement that I do with some patients, and I do it because it's easy, or at least it's easy on some folks, but it's not one of the normal, regular, STAP 6 or anything like that. But basically I just have them, bend over like this, hands supported here so they're in charge of how far they go. And I think I made a video of it, one time in the past. But basically they just check both sides, and sometimes they'll find one different than the other. And then as they progress and they get better and better, then they'll say, hey, both sides feel the same, but then what I'll do is add something, which is just making the leg go out wider. And then sometimes they can see a difference or feel a difference, sometimes not. But the interesting thing is I got this one patient doing that, and then he comes in and he says, well, let me show you something, which is pretty cool. So, he does this and both sides feel the same. Goes out wider, both sides feel the same. So he adds a twist to it. So he bends over and he checks going out to the side or going inside, and obviously checks both sides. And then what he told me he did was, he found out which side felt the easier by doing this, and then what he did was he kind of bent to the inside, bent to the outside to find out which direction was easier at that point. So, just an example of how your patients can teach you things. So I've shown that to a few other people through the past few weeks. Anyway, that might help, might not, might make it more confusing.